Since the nation's founding, states were understood to have primary constitutional authority for addressing public health crises like epidemics. States inherited from their revolutionary origins the police power to make laws to promote the health, safety, morality, and welfare of the community. The police power was not delegated to the federal government by the Constitution, and the Constitution gave the federal courts the authority to monitor whether the states had exceeded or abused their police powers. We might reasonably think that the state and federal precedents dating back to the 19th and early 20th century are inapt for grappling with the present situation. The United States Supreme Court has been more amenable to a right to interstate travel in the 20th century, suggesting that state restrictions on travel implicate not only interstate commerce concerns, but also individual liberty concerns. The court has also been more solicitous to substantive and procedural concerns about restrictions on individual liberty in recent decades, which suggests the deferential posture that the courts tended to adopt during the historic epidemics of the 19th and early 20th century might no longer be appropriate. States might be expected to demonstrate that the aggressive preemptive measures that they've taken that limit the liberty of even the presumptively uninfected are not merely reasonably geared towards slowing the spread of dangerous disease, but narrowly tailored to accomplish that result. American constitutional law relating to government authority to address public health emergencies has primarily been developed around the states, and often in the state courts, interpreting the provisions of state constitutions. The U.S. Supreme Court has likewise long recognized the police power as at the core of the constitutional authority reserved to the states, as recognized in the 10th Amendment. Although there are potential tensions between how the states might choose to exercise that authority and federal constitutional authority, such as the congressional authority to regulate interstate commerce, the courts have generally been deferential to reasonable regulations promulgated by states to address public health crises, even when those regulations impinged on the flow of commerce across state lines, as in the case, for example, of a quarantine that might prohibit sources of infection from entering a state, or prohibit those outside the state from entering into a quarantine zone inside of a state. State and federal courts have also given the states wide latitude to adopt reasonable regulations restricting individual liberty in order to address public health crises like epidemics. State legislatures have traditionally delegated sweeping authority to executive branch officials to identify dangerous and infectious diseases and to issue appropriate regulations for countering the spread of such diseases. In practice, this has often meant that state and local health officials have been empowered to declare an infectious disease sufficiently dangerous to be regulated and to take such measures as requiring testing and isolation. Certainly one worry about our current situation is that our historical experience has been that governmental power tends to grow during crises. That's true about the federal government, and we tend to expand national power and the power of the federal government in particular in the context of national crises. But it's also true of state and local power, where government tends to claim more power in moments of crisis, and it tends not to give that power back.